Namaste. In part 1 of paranasal sinuses, we are going to understand the anatomy and the physiology of PNS. What is PNS? PNS are outpouchings from the lateral wall of the nose. Let's define them. They are air-filled cavities present in the bones around the nasal cavity, lined by the respiratory epithelium, that is, the pseudostratified ciliated columnar epithelium. They communicate with the nasal cavity. Let's see the four paired sinuses which we have. The first one, this is the frontal sinus. Next, we have the ethmoid sinus. Third, we have the sphenoid sinus. And fourth is the biggest sinus which we have, that is the maxillary sinus. Here the ethmoid sinuses are divided into anterior group of sinuses and posterior group of sinuses. The frontal sinus, the anterior group of ethmoid sinus and the maxillary sinus, they form the anterior sinuses. And the posterior group of ethmoid sinus and the sphenoid sinus together form posterior group of sinuses. These are the four paired sinuses which we have. Let's move forward and look at the functions. The functions of PNS are very easy to understand if you remember the definition of what these actually are. So what are PNS? PNS are air-filled cavities in the bones, right? So the first function is they lighten the skull bone. Now what happens if you sing in a roomy space where there's no furniture? You get resonance to your voice, right? So here also the second function is resonance is provided to the voice. Next, it also gives cushioning effect. That is, it prevents the skull from trauma. It protects the structures in the skull. And the last and the most important function is air conditioning. Let me explain air conditioning here in physiology. So what happens during expiration is air encounters resistance. At the nasal valve area, which is also the narrowest part of the nasal cavity. Then due to this, there is an increase in positive pressure. There is an increase in positive pressure, which leads to reverse currents known as the eddy currents. And these eddy currents ventilate the sinuses. The clinical significance of rhinitis is that rhinitis or any nasal infection will cause edema of the nasal cavity and hypersecretion of mucus will occur. Because of this mucus, obliteration of sinus openings will occur. Or this infection can directly spread into the sinus, which can lead to sinusitis. And together, when these two occur, they are called rhinosinusitis. And sinusitis almost always occurs with rhinitis. Thank you. We are done with the basics, and in the next video, I'm going to cover each sinus independently. So please subscribe for more videos.